Good evening. I'm Marion Dry, Chair of Class Act HR 73, and it's my great honor to welcome you to this evening's forum. Reproductive justice: is being pregnant a crime?
Pregnancy criminalization is actually quite simple. It is the criminalization of pregnancy where folks are punished or penalized for actions that are interpreted as harmful to their own pregnancies. Pregnancy Justice is a legal not-for-profit, focuses on these cases, and we work with allies, we work with public defenders, we work with lawyers all over the country.
Planned Parenthood is an organization that provides a wide range of healthcare services. Planned Parenthood mostly provides STI testing and treatment, all FDA-approved forms of birth control, breast and cervical cancer screenings. Where abortion is still legal, Planned Parenthood is still a provider. On July 4th, the president signed HR 1, was the so-called Big Beautiful Bill Act, which contained a lot of really harmful things, and also included this defund Planned Parenthood provision. So what that means is that every Planned Parenthood across the country has not been able to bill Medicaid. And so there's really a patchwork of different responses happening.
When we look at this rising role of criminalization for people for their pregnancy outcomes, it is simply a reinforcement of the dominant narratives and long-held beliefs about the need to control the health and well-being of the pregnant person's body, right? So we're talking about patriarchy undergirding medicine. As a doctor, I must know what's right for you. You must need to come through me to be able to take good care of yourself, right? And so the reason why I lift all of those things up is because if it is truly our desire to interrupt these acts of criminalization, we have to begin with acknowledging where we started, how we got there, so that we can begin making the repair. Physicians for reproductive health, we are doctors. And so we recognize that as physicians, we hold a lot of power and privilege. And as we began thinking about the impact that this was having on the patients that we care for, the communities that we served, it was an easy choice for us to step into this fight full force and to acknowledge and admit that the vast majority of people who are criminalized because they were seeking healthcare services. So it is their healthcare provider, it's the doctor, it's the nurse, it's the social worker that is then putting them within the snares of law enforcement.
Even before Roe versus Wade, access to reproductive care has been chipped away. For one thing, in a more recent past at the state level, many providers, well-intended providers, we'll just stick with those, are confused. What am I supposed to do? Do I need to report? Do I need to not report? Can I give care legally? They get on the phone with the lawyers, and meanwhile the patient's bleeding out. It's not a good situation. So providers and patients are often in a reactive and even a crisis mode. The fact that we can think about a systems approach to affect change, I'd like to hear from all the panelists of what they think that could look like, how we might collaborate among organizations, and what sorts of grassroots efforts we might take.
The benefit of a systems-based approach is really to zoom out, to think about what are the levers that we can pull. So whether we're talking about policy and really thinking about what those policies, who those policies benefit most, and what is the likelihood that all of us would get the benefit. For healthcare providers like me, it means being in community and really working alongside those folks that are directly impacted as we seek solutions to care. When we think about what this looks like, really concrete things in the medical realm, it means accountability for healthcare systems and healthcare providers. A lot of times this turning over of information that results in criminalization is a HIPAA violation. And so we remind our colleagues that by turning over medical records and charts full scale to law enforcement simply at their request is a violation of HIPAA. And so being really clear about what the law is and how you can uphold it, also understanding that you have an opportunity to refuse to collude. I think that there is a belief that simply because law enforcement asks that you have to say yes. And I can tell you from experience, that's simply not the case.
About what are the laws in your state today? How are people being impacted by that? I would encourage folks to figure out, if you don't already know, who is your local Planned Parenthood affiliate, and how are they being impacted by the defund? What's happening to patients in your communities? Where are they going, and what are the actions that you can take? Because one of the realities is that because the situations are so different across the state or across the country, is every state has has a different solution.
If someone is pregnant and they have an incredibly high fever, that can lead to some very specific difficulties and harms for the fetus, right? This is not just something to play around with. Tylenol treats a fever, which could actually make a pregnancy safer. But now we are in a territory where Tylenol is being made suspect, which means that if people are thinking of it as a dangerous drug, and you live in a place where any drug use can be, during pregnancy, can be determined to be a criminal act, then we are getting to the place where providers who know that someone has taken Tylenol, or anyone who wants to kind of snitch on that person, might make them susceptible to criminal penalty.
The role of the Food and Drug Administration is to take the science, the evidence-based, and to make decisions about the safety profile of medications based on medical evidence and scientific evidence. What we've seen under this administration is a co-optation of that power, and instead we're seeing drugs that are safe, like mifepristone for medication abortion, being targeted and restricted through lots of mechanisms, and ultimately criminalized and restricted in ways as if they were dangerous medications.
The vast majority of patients who come to Planned Parenthood to access abortion end up choosing medication abortion. And that's for a few reasons, but one of them is access. States like California have said that mifepristone is so safe, and it is so safe to be dispensed by advanced practice clinicians, right? It doesn't necessarily have to be a physician. And that is now one of the issues that is at odds with this FDA, because ultimately limiting prescriptions to doctors only has the impact of dramatically limiting access to this very safe and effective early pregnancy abortion, abortifacient medicine.
This past year, in the last legislative session, there were 10 different states who tried to introduce bills that would equate abortion with homicide. Okay, so they would make abortion a felony, which would, in fact, in many of those states, make them a death-eligible offense. Okay, so what that means is that if you provided information about an abortion, you could potentially be an accessory to a crime. And it also means that these states are kind of changing the definition of legal contraceptive and adding a new definition of human embryo, so that there would be new restrictions on currently available methods of birth control and family planning.
I think that this is a really long-term fight. And I think one thing you can always do is pick up the phone and call your member of Congress. It's always a good idea to just really make sure that you know who your member of Congress is, you know who your state and local officials are, that you have those numbers saved in your phone, and that you are being vocal.
Keeping your lawmakers accountable. Know who they are. Pick up the phone. You don't necessarily have to talk to them. Usually you get a voicemail message anyway. Just say, I live in your district and this is what I think.
So in addition to fighting for what's happening in your own community, and this is truly my call to action, understand that what's happening here in the district today, under federal occupation, the militarization of our streets, our police forces, will be coming to a city near you soon. So understand, again, my call is to realize that our liberation is bound. And so we cannot fight this one by one. We can't focus only on abortion, only on pregnancy criminalization, only on immigration, but understand that these things are deeply interconnected. And then as an abortion provider, I would say, please donate to abortion funds in your communities and around the country. These are folks that are providing not just helping folks actually pay for the abortion, but true wraparound services and material needs for folks.
you as one person can do a lot. Sometimes that is bringing cookies to your local to your local Planned Parenthood and just being like, thank you for what you're doing, because that is giving someone else a moment of rest and a moment of recognition. And that kind of soul resting, that interconnectedness, that care is deeply, deeply important to being able to stay present and to be able to do the work that we all, I think, need to do to meet this moment. And then the other thing is, I think, and I'm just going to say this a lot, I've been saying it a lot recently, but I think people think that hope is like Tinkerbell, and you open a bottle and hope flies out and she's dainty and all that stuff. Hope has a bloody nose. Hope has ripped clothes on. Hope is dirty and scratched up and beat up because she's getting knocked down and she keeps getting up and staying in the fight. And so I think we have to recognize that hope is a practice, and it is a practice that is difficult, and it is a practice that is hard. But every time we allow ourselves to do that, she comes back. And so I think we have to work on building hope in ourselves and hope in other people.
And I would encourage you to have hope and joy in the hope, because it will bring us forward. And please share this forum, the videos of this forum. There's going to be a short one and a long one. Share them with everyone you know, because the information that we have received tonight will help us all take action. Evening.